The following program, Live and Learn, is made possible by Aging Partners. Find out more on their website.
Hi everybody, welcome to Live and Learn. I'm Kim Hachia. Today we're going to be talking about having a difficult conversation, a conversation about how you want your life to end. Thanks for staying with us.
Hello and welcome to Live and Learn. I'm your host, Jerry Renaud. The COVID-19 pandemic has caused lots of problems across the city, and it's meant lots of cancellations in a lot of areas. One of those has been the postponing of some of the Aging Partners fitness classes. We have a great guest to come in and talk about that and to figure out when and if those classes are going to be offered soon. It's Tracy Foreman. She is a community health educator for Aging Partners and a certified personal fitness trainer. You won't want to miss it. Stay tuned.
The misuse of opiates, including prescription painkillers, is a serious problem that can affect an individual's health as well as their social and economic welfare. I'm Doug Joes. Stay tuned for an insightful discussion about the treatment of opioid addiction.
This and more on today's Live and Learn.
Hi everybody, welcome to Live and Learn. I'm Kim Hachia. Today our conversation is going to be about having a very difficult conversation, a conversation about managing our own deaths. My guest today is Erin Reho-Putney. She's a nurse educator, and we're going to talk about how you initiate that conversation for yourself or for your family members. So welcome, Erin.
Hi, thank you for having me.
Yeah, thank you. So how do you talk about, you call it a courageous conversation. How do you define that?
So a courageous conversation is a conversation that is uncomfortable to have. It's that conversation that you've got to step into, but it's an important conversation to have. And particularly with this one, we're talking about the end of life. We don't frequently talk about how and what we want as our time becomes limited, and that leads to a lot of complications in people's lives and in grieving processes. And so it's really important that we voice our wishes, and it gives a lot of power to our own choices and to our own voice.
I know that you're a nurse, and you've worked in ICUs and in trauma, and maybe that has helped inform you about why you're so passionate about having these conversations.
Yeah.
So maybe a really brief situation of what you've seen that it could have maybe gone better.
Yeah, absolutely. So I worked in ICU trauma, both in Omaha and in Lincoln, and I've seen a lot of times where people haven't had those conversations and decisions have to be made. And when we're in that emotional fog, we're not making necessarily rational choices, we're not making well thought out choices, and we're just making choices that are quick to the moment. I've seen patients who have come in at 3 a.m. and they're still bleary-eyed from sleep and they're exhausted and there's just such high intensity of emotion. And then you go and ask them, well, do you know what your loved one wanted? And they're like, no, we never talked about it. And so by not telling them, you actually are causing them more stress and grief during that time of heightened need. On the other side, when people do have that conversation, they say, yeah, Grandpa never would have wanted all these machines. He never would have wanted all of this. He doesn't want to live on a feeding tube or something like that. You've empowered that family to be your voice and to express the choices that you wanted. And it really, really helps with the grieving process afterwards, because there's no guessing. They knew what you wanted and they just had to be your voice.
Right. That's an interesting thing to think about, somebody being able to speak for you when you're not able to speak for yourselves.
Right.
And we were actually going to tape this before the COVID-19 epidemic took over, and I think now that it's probably an even more important conversation to have, because that seems to be so, it can overtake you quite rapidly.
Right,
so.
It absolutely is. Right now, I still work as a nurse in the hospital, and I've seen my fair share of COVID patients at this point in time, and it's so hard to listen to those families because they've on the phone, right? Because that's how we're having to communicate with them. They can't come into the hospital, they can't come in and see their loved one. And so we're doing it over FaceTime or Zoom or whatever our technology is. And you're having to have those end-of-life conversations that way with some people. I mean, a lot of people obviously are doing well and rebounding and getting home, but the fear of them not knowing simply what's going on, it's a little crushing on the heart, you know. And if they had at least that piece of information, then they know, like, this is what your wishes are, this is what mom would want done. And they're, again, that guessing. Anytime we're guessing, we're starting to complicate the grieving process and the hurt.
Right.
And so, yeah, the pandemic has definitely brought some different challenges in to everything that's going on.
So if you were wanting to initiate this conversation, how do you think, how should we get started with that?
So, I mean, right now there's a pandemic going on, so the opportunity is definitely open for that conversation. If I should get COVID, what do you want? Big things is we also need to listen when our families are telling us something, because it is an uncomfortable thing for people to be like, hey, when I don't want to do more aggressive care, and people are like, oh, I don't want to think about that. I don't want to think about my mom, being in the hospital. So it's really important that we listen to our family members when they start to initiate it. It's really important to discuss if you're doing any POAs or DNRs or living wills. That's a very appropriate time to discuss it. If you've had family members who have gotten sick, that can kind of lead into it. One of the fun ways to do it is to talk about your bucket list and just be like, hey, what's on your bucket list? And then you can kind of step into it as well as another way of just kind of, okay, well, that your bucket list is this, but then, so what don't you want done?
Right.
So, and it's really important to understand what living is to each individual. I've taken care of a rancher, and if they couldn't have steak and eggs for breakfast every day, or chew meat, that's not living to them. And so they want to be able to live. So that becomes part of it too, is, well, what is living to you? Mm-hmm. So that's kind of the processes, but really just listening, and sometimes you just have to take that deep breath and ask.
Yeah. And so what would that ask be? Just, what do you want me to do?
Yeah.
Is that just,
it's just that, like that, like, okay, Kim, what do you want your life to look like at the end? What kind of machines do you want? What machines don't you want? What tubes do you want? What tubes don't you want?
So would that be a situation too where you might want to include your healthcare provider, because they can maybe give you a little bit more an idea of what a ventilator's like? I think we've all sort of now realized what a ventilator is, because we've seen so many videos and things now that it's not just the little things they put in your nose with the oxygen tank. It's seriously invasive.
Right, yeah. So it's kind of interesting. I always think that that the public is very educated about like their own health sometimes, but like really like Grey's Anatomy, MASH, depending on what your era is, all those medical shows, they don't really show what medicine is and how the different, they might have the right machine there, but they don't necessarily show the right ways that we use them. And so it's really important to involve a healthcare provider when you're having your yearly physical or something like that, or you go in. I will tell you, some healthcare providers are really uncomfortable with these conversations. So you may go in there and you may be leading the conversation of like, hey, I want to discuss this with you. What are my options? What are your thoughts? Especially if you have any illness that is a life-limiting illness or has a terminal end to it. What do you want your end to look like? So anytime you get diagnosed with something, it's something good to think about of like, what's the end of that disease going to look like? And it actually gives you a lot of power over it, because then you know the symptoms and the signs that you're looking for. So it's really important to involve your healthcare provider, but know that you don't have to. If you're a person that doesn't go to the doctor very often, your loved ones are the ones that are going to be your voice and are going to be the ones making those choices for you.
Right, right. So is this a conversation you should only have with your older relatives or your parents or whatever, or is this a conversation everyone should have?
This is really a conversation everyone should have at any age. I have teenage boys, and unfortunately they get subject to a mom that comes home after working a 13-hour shift in an ICU. And so we sometimes have these conversations at breakfast, like, hey, don't try and outrun a train. Also, you know, what are you thinking of, what is living to you at this age? When they get their driver's license, you get the option to sign up for organ donation when you sign your driver's license. That's a perfect time to have an end-of-life conversation, just to even start planting the seeds of what that kind of conversation is. But at any time, and I know it's not like you want to sit at the dinner table, but really, like, end of life and death, we need to stop kind of hiding from it, because it's going to happen to all of us. I think Jim Morrison says no one gets out of here alive. I mean, just really, really true, we don't. And so we all need to have that discussion. I've seen end of life where it came with elderly people and their disease process progressing. And unfortunately, I've seen end of life that was a young mom that had been in a car wreck. And so choices have to be made. Once we put that ventilator on you, once we put that tube down your throat to breathe for you, you are no longer part of the conversation. Your voice no longer gets to be heard. So you have to make sure that your voice has been heard by the people that are the ones sitting in those chairs and having those hard conversations.
I know that you, as a nurse educator, you're training other, new nurses, new healthcare providers. And are you personally trying to get them to understand these kind of things too?
Oh, absolutely. So I train new nurses, and I'm lucky enough to teach at a community college where there's such diversity, not only in ethnicity in my classroom, but also in age and experience. And so it's neat to hear the different conversations that people have. But also, when we're teaching our younger nurses, so many of our youth have not seen death. Maybe a grandparent died, maybe an aunt or an uncle maybe passed away, but they didn't see it. They didn't see this or the dying process. So we come to death really vulnerable and pretty naked in a sense. And so it takes a lot to get them to be really aware of like where they are, and trying to empower them to have the courage to walk into those conversations, and sometimes even initiate those conversations at the bedside, and to be able to listen when patients open those doors, because patients will open doors for us, but sometimes we're scared to walk through them too. And so we have to have the courage just as much to walk through it and be like, okay, let's sit down and have this conversation.
Right. I never thought about that I think a lot of patients are willing. I think back up both of my parents and their end of life experience, and I think they were much more realistic and willing about it than maybe some of us were. My parents were both in the healthcare field, and so they had a little bit more knowledge of what was going on. But if you're a naive person, not naive, maybe not the right word, but a person who just has not had that experience, that and all the sounds and it's all very scary.
Right, and we can have, death can be beautiful, just like birth. Birth is messy and gross, but beautiful. Death can be the same. And so we really need to stop hiding from it. We need to embrace it. I always tell my students, I'm like, live your eulogy. Think about how you want to be remembered, and let that be how you live every day. If I want to be remembered as an avid runner, I probably should own some running shoes. I don't own running shoes. I don't necessarily want to be an avid runner. I want to be remembered as a fun mom, as a caring person, so I need to act those things every day. And then it helps you prioritize things when people are like pulling you in this day and age of being pulled so many different directions. If we live our eulogy and you understand how you want to be remembered, you can prioritize the important stuff.
Right. What an interesting, that's an interesting way to put it, so that, help your family in two ways.
Yeah.
You let them know how you want to go, and you let them know how you want to be remembered.
Yeah.
That's really a gift. I know you've talked that these conversations, although difficult, are a gift to your family, because it takes away the scariness and the fear and the unknown. And
Right.
I think that's more scary than anything.
Yeah.
Is not knowing is really a hard part of it. And if you've got all the other stuff kind of figured out, then you can focus on the moment, on the being there and the not
Yeah.
You know, there's not as much trauma involved there.
Absolutely. Like,
Yeah.
I mean, like I said, no, we're all eventually going to get there. If we can take the guessing out of it, the gift is knowing.
Yeah.
Knowing what you wanted, and then being able to be like, this is what my mom wanted. This is what she wanted. Because sometimes people keep pushing for other things, and it's like, no, this is what my mom wanted. And then you get to have that beautiful death, because you get to be respected and dignified as your own person who made your choices. So it's not about the choices that we want. Like, I don't want my mom to die. I don't want anyone to die. But they get that voice, and they get that control a little bit more.
Right, right. Thank you, Erin. This has been a lovely conversation. We could talk for hours on this.
Oh, yeah.
and you and I have.
Yeah.
So anyway, thank you so much. I'm really glad that you agreed to come in and talk to us about this today. And I want to remind our viewers that it's never too late to live and learn.
Hi, I'm Randy Jones with Aging Partners. Did you know that Lincoln expects a 75% increase in the number of seniors living in our community over the next 15 years? Aging Partners is a community service that provides fitness programs to help keep older adults strong and healthy. This year, Lincoln Cares donations are providing funds for new fitness equipment. You can help make this happen. Sign up to support Lincoln Cares and add $1 to your LES bill each month.
Hello and welcome to Live and Learn. I'm your host, Jerry Renaud. We have an interesting show for you today. We want to give you some information, but we also want to give you a little bit of a demonstration on some things as well. So we're glad that you tuned in today. This is normally the time of year when we have a program and we talk about all of the great upcoming fitness classes that Aging Partners sponsors. That's a little challenging right now, as you well know, because of the COVID-19 issues. And so there's been lots of cancellations, lots of postponements, I think that we would like to call it, since eventually these classes are going to come back. But the question is, when? And that's a good question, and we're not sure that we have an answer. But we do have a wonderful guest who is with us today. It is Tracy Foreman. She's a community health educator at Aging Partners, also a personal fitness trainer, if I can get it out. And so she's here to talk about the classes and some things, and we're going to give a little demonstration a little bit later as well. Tracy, thanks for being with us.
Thanks for having me.
So let's talk about the classes. It was a move to postpone the classes until things get a little better. That was obviously the right move to make for safety purposes. What can you tell us about where that stands right now?
Well, we don't have any definite opening information yet, or when we're going to get back to the classes as they were. So right now we're just kind of going along with what our health department is telling us and what we're hearing from the mayor. And of course, she works directly with the health department. So very optimistic. We'll be opening our classes again soon. And we even have a participant who has been waiting to get into our fitness center since about February. So
yeah, there you can see that.
Oh, there he is. It's been a long wait. Everybody's anxious to get back, and we are going to be offering classes, we hope, in the very near future. So call the 441-7575. You'll see that on the screen, and you can check into what news we have from day to day.
And there is talk about perhaps these classes being offered up on Zoom as well, so you could take the classes right from your home.
That's correct. Like everyone else, we're trying to figure out a new way to do things, and so we're learning how to do Zoom classes. So we appreciate any of our current participants or interested parties to let us know if they're interested in Zoom, and we'll get them connected to our different types of classes.
And we shouldn't forget that a lot of these classes have been taped, and they are on the YouTube channel. And so if people would like to tune in, it's the full classes. I've done it several times, and it's not quite the same as being there with a group of people and having somebody take you through the process, but it's still pretty good.
Well, and the social distancing is certainly in place when you're doing it on TV.
Absolutely.
But you can get all of our programs on YouTube or on the LNK TV stations depending on what service you have, and you can give us a call. We'll send you out some information on that. But on our YouTube channels, you can get all of the different levels of Tai Chi. You can get Qigong, you can get dance, you can get yoga. So the options really go on and on.
Now, I'm glad you mentioned the Tai Chi because
Yes.
one of the things about Tai Chi is that, particularly the 24 form, is that it is something that you really have to know. You have to pretty much have it memorized and be able to go through the process. It's not like the Qigong where you can make the quick demonstration and then everybody can do that. Now, I went through the process when we had beginning classes through Aging Partners, but for a number of reasons it's been difficult to sort of offer those classes again. But we're going to try to create an alternative, right?
Yes, we are. Jerry and your wife are excellent students, and they have been regular attenders for a long, long time. And Jerry has agreed to co-teach a 24-form Tai Chi class with me. So you'll be seeing that on YouTube pretty soon, and that's exciting. And so we're going to be practicing pretty soon here, and we may be offering more Tai Chi out in the park. We'll be doing some outdoor things, but pretty excited for this 24 form. And that is the more difficult of the two that we offer, the 8 form and 24.
It is, and it is, I mean, we're not just going to go through the 24 form. We want to demonstrate it. We want to show people how to be able to do this. So when we get to the point of being able to offer the classes again, we can all get together. People will have had a chance to practice it and to be able to come to the classes.
Absolutely, and that's one of the things I want to encourage people to do. If you don't get on YouTube, I would encourage you to start doing that if you have a computer, and look up some of the fitness alternatives there. We have lots of our programs through LNK TV. You can type in Aging Partners, Tai Chi or Qigong, and all kinds of things will come up for you. So I hope people are taking advantage of that option.
Yeah, I'm amazed at the number of opportunities that there are that are available for people. So it really, whatever it is that you are looking for, there's a short version of the Qigong, there's a longer version of the Qigong, same with the Tai Chi, there's the 8 form. So there's just lots of things out there for people, aren't there?
And the 24 form will be done probably in 2 parts, and Jerry's going to do part of it, and I'll do part of it, and then we'll work together on it. So
yes, very good. Okay, that should be fun. Scary for me, but I think it'll be
it'll be great.
It will be fun. We're going to give a little demonstration here because you and I are concerned that people aren't getting a chance to come to the classes, and what we don't want is for people to be able to just be sitting at home, staying safe, which we like that part of it, and we have our masks here. You've probably seen those in some of the shots. So we're going to give a little demonstration about how to do some of these things that you can do very simply just in your own home to at least get some movement going. We think that is important. Another aspect that you and I have talked about is when you are sitting at home and you are staying safe, sometimes the information that comes about COVID-19 is challenging because there's so much of it, and so much of it is negative these days. Let's talk a little bit about the stress factor, because we don't want people to be stressed out by it.
Well, you know, there's a joke out there, Jerry, that where a doctor had a patient come in and say, I broke my leg in 3 places, and his response was, well, don't go to those places anymore. So what I would say about the news is watch and stay up to date on things, but don't sit for hours and hours watching, because it is depressing, and sensationalizing is something that really gets more viewers. So we want to be careful about that. And as I said, we work with the health department, and our local health department will keep us updated, but be careful because it can get very depressing, especially if you're closed into your house and not able to get outside.
Absolutely. So. As I told you, I'm a news junkie, so it's on a lot in my house. But sometimes even I go, boy, this is too much. So we want people to be concerned about their stress levels. We want you to stay safe, but we want you also to be relaxed, to get some movement into your life so that you'll feel better And so why don't we do a little demonstration? I think it's time we can do that through the magic of our wonderful staff here. We're going to transform our studio here into a little workout space, and we'll be right back with you. Okay, we are back now into the studio, thanks to Bo and Melissa. And what we'd like to do is to give you a little bit of a demonstration of some simple things that you can do at home. If you'd like to join us today, it's going to be real simple, right, Tracy? It's not going to be anything that anybody has to learn or be concerned about. And of course, the great thing is you can do it right in the privacy of your own home. So if people want to join us, what are just a couple of simple things that they should probably do?
Well, be sure you're in comfortable clothing, no stiletto heels, but if you want to go barefoot, you can certainly do that. Make sure you have a comfortable chair that's nice and solid, and you don't want to do it from a recliner on the couch or a rolling chair especially, but make sure you've got a comfortable, solid chair and comfortable clothing.
Yeah, and the good thing there is that it helps keep your back straight in that regard, so that's really what we're looking for. It sort of helps in the stretching of those muscles as well. And really that's kind of what we're looking for from a seated position, is we certainly want to stretch our muscles out a little bit, but we also want to do some breathing exercises, which we hope is a stress release.
That's correct. We're talking about reducing stress now through this situation that we're all in. So let's go ahead and begin with our breath.
We'll follow you.
We're going to stay away from the back of the chair. You don't want to lean back because we want to open up that rib cage and thereby opening up those lungs a little bit. So let's go ahead with our straight back, hands resting easily on our knees. And let's take a deep breath. We're going to do something called a roll breath, which begins down in the lower abdomen, moves up through the diaphragm and into the chest. So let's breathe down into the stomach. Inhale through your nose. Bring it up through the diaphragm and into the chest. And now exhale through your nose also, down with the chest, diaphragm, and stomach. Let's do another one of those. Inhale, stomach, diaphragm, chest, and exhale. Now let's bring our arms and shoulders into this a little bit. We'll start with our arm down at the side and inhale, reach it up high. Inhale, stretch it up. On the exhale, we're going to drop over to the other side. Feel the stretch down the side of your body. It feels nice. Works into our back a little bit. Now inhale, back up, reach it way up there. And exhale, turn your palm down. Bring that arm down. Let's do it on the other side. Inhale up. Now keep that other arm down at your side. Inhale. And on the exhale, we're going to drop that arm down on the side. Come over the top with the other arm. Inhale up. And exhale down. Let's do a nice stretch on the side you started on. Inhale. Exhale. Breathing in and out through your nose. Inhale up, reach. And exhale down, relax it down. One more time on the other side. Inhale up. Exhale over to the side, feel that stretch. Inhale up. And exhale down.
Well, you can really feel the stretch on that one.
You can feel that in your shoulders, can't you? Now let's inhale and reach forward. Nice, gentle pull forward with the arms from the shoulders. And exhale, push back. Imagine that you're pushing back with your palms. Inhale, lean forward, lean into it. Feeling a little bit of work in your legs here. Exhale and come back and push back, leaning back slightly so you engage those abdominal muscles. Inhale forward. Exhale back, doing a little bit of a pelvic tilt here. One more time. Inhale, now reach as far forward as you can. Reach forward. And exhale, push back.
Those abdominal muscles are so important and so critical.
Oh, they are.
In so many things.
They help to keep us upright.
Yes.
And so we really need to work into those muscles. So let's bring our palms up. I am a Qigong instructor, and so I like to do the inhaling and exhaling with palms up. You can feel the energy pull up. Inhale, bring your shoulders up to your ears. And exhale, push down. Inhale, bring those shoulders up. Exhale, push down. Feeling that rib cage lift as you inhale. Exhale, let that rib cage lower gently. Now we're going to bring our hands up. Inhale up to our chest. Exhale out. Inhale back in. And exhale, push down. Inhale up to our chest. Exhale, push out. Inhale back into our chest. And exhale down. Now you should be warming up. Can you feel that a little bit, Jerry?
I can certainly feel it. And that's a nice Qigong move.
It is a nice
as
Qigong
well. That's
move.
one that is a good stress relief as well as getting a little stretching going as well.
It's very nice. So let's go ahead now and stretch our spines a little bit. Let's do what we call hold the ball. Your hand is hovering at the top of your ball and the other hand is down below. So what we're going to do is push that top hand down on the inhale and rotate that other hand up, palm facing the ceiling, and you can feel that spinal stretch. You feel that?
Oh yes.
And then exhale back down to the ball. So now your other hand is on top of the ball, and we're going to inhale, push down with that hand, rotate the other hand up, feel the stretch. You might even hear a pop or two in there. And exhale down. Let's do another one on each side. Inhale, push down. Push down as far away as you can get your arms. Nice distance between those arms. Exhale back to that ball. And inhale, push down one more time. And exhale, bring it up. Now let's rotate our ball and bring our hands to either side of that ball.
And I found myself holding my breath, and that's not
that's
not a good thing to do, is it?
You want to keep breathing
Yes.
through that. And our lungs may not be used to that. So let's inhale now, pull out, inhale, expand that energy, and then exhale, pull it all back in. So let's go ahead and imagine a mantra that you could use here. I'm taking positive energy in and getting rid of all the negative energy as I exhale. Inhale, positive energy. Now, blowing it out of your mouth, exhale, negative energy out. One more time, inhale, positive in. And exhale, blow all of that out. Now let's move down to our lower body just a little bit and stretch out those legs. We're going to bring one heel down and let's bring our hand back. So on the inhale, we're going to pull our leg up and push our arm out. So we're bending slightly over that quad muscle. And then exhale, pull back, pull your shoulders back slightly. Inhale, push forward. Exhale, pull back. Inhale, stretching that leg and that arm out. Exhale, let's do one more on this side. Inhale, should feel that quad muscle at the top of the leg engaging, and exhale, pull it back and relax that hand down. Let's do it on the other side. Bring your palm up. We're going to change our breath this time. We'll exhale as we push forward and then inhale as we come back. So exhale as you push out. Inhale as you pull back. Bring that shoulder back slightly. Exhale, push out. Inhale, pull back. Exhale. And inhale, we'll do one more on this side. And exhale, and inhale.
Now that's a new one.
That's a new one. You haven't seen that one.
You're spending your time well then.
Yes, there you go. We've got to learn some new things.
Yes.
So let's bring our knees wide, and this is one that I think is about everybody's favorite. It feels so good on your back. So we're going to do a big circle here. reaching the crown of your head out as far as you can reach it. And then you come around that full circle and tilt back slightly so you engage your abdominals and tilt your pelvic region back as you come back. Tucking your tailbone under. And if you've got lower back issues, this is a nice one to help to relax some of those lower back muscles. And now let's switch up our direction. Go the other way. Around the corner. You feel that in your back?
I do. Feels
Yes.
really good.
It is a nice one. Okay, let's bring it up to neutral position. Now we're going to move to a standing position here, and the way I'm going to have you do that is one of the ways that we can help ourselves to get out of a chair more effectively. Rather than pushing with our arm and using our abdominals to pull up, we're going to place our hands on our knees, bring yourself forward, nose over toes, and power up through your legs. So rising very slowly. Now Jerry, let's go back down. We're going to make sure your chair's back there. That would be the disadvantage of a rolling chair, of course.
Yes.
You would
I always have to look, make sure my
always
chair
look and
is
make
back
sure the
there.
chair's there. Let's power up again, nose over toes, and come up to a standing position. Okay, that's a great one to strengthen your legs. So if you
Yes.
have weak legs, that's a really good one to do 5 to 10 times if you can. And if you want to make it harder, cross your arms as you're standing up. So now we're going to do a few standing things that will help us to release those back muscles and get our balance going a little better. One of the things that I struggle with, I've noticed, as I get older, is my balance. So some exercises can really help with that. We're going to start with something called a Tai Chi Twist, and if you just separate your feet a little bit so you have a nice solid stance here, and relax your muscles as you just flop your arms. You might have heard this move called Ragdoll Arms or Tai Chi Twist or Arms in the Wind. It's called many things, but just letting your arms kind of flop. In our Tai Chi and Qigong classes, we almost always do this one. This is a nice one if you've got stress going on and you just want to release some of that stress. Just normal breathing through this twist. Okay, now let's just reach it to the side. Reach, come up off of one heel, reach. So we're redistributing our weight when we do this, but keep your breath moving. Like Jerry said, you have a tendency to want to hold your breath. So just keep your breath moving nice and easy.
And none of these movements should be stiff. I mean, I see
No.
people sort of doing this sometimes. It should just be just as fluid, as relaxed as you can make it.
Never lock your joints. Never lock. You just want everything to be nice and soft. We have a tendency to go through life very rigid and
Yes.
we worry and we have too much stress. So just releasing your joint. So let's do that a little bit. Let's just release our joints and get a little bit loosey-goosey.
Yeah, people tend to tighten up their shoulders a lot of times
They
too.
really
just,
do. They really do. So let's
go
do a
through life.
couple of shoulder rolls here. Keep your knees soft. So your knees are really meant to be your shock absorbers. And when we stiffen or tighten or lock those knees, then you are going to be more prone to injury. So soften those knees. And then let's go ahead and take it forward now. Roll, soft knees. Kind of like a swim stroke without the water.
Yeah.
Okay, so let's go ahead and do just a couple of balance moves. We'll do one that's just called a calm walk, and this one actually stretches into your leg. Place your hand at your chest with the other hand behind, and let's step it forward with your heel down first. Come off of that back heel as you rotate your hands down, and then pull back. So this is a nice stretch for your legs. Can you feel that moving up into your calf and
Oh yeah.
the
Back
arch?
leg really feels it.
Yeah, the arch of your foot. And then pull your head up, chest comes out just slightly. Inhale now as you come forward. Exhale back. Let's do one more on this side. Inhale and exhale back. Let's bring it back. Let's switch hands now. Do it on the other side. Heel down forward and push off that back leg and rock back. Push off and rock back. Push and back. Push, and let's pull that leg back. Let's do one that helps us to get into our ball and socket joints of our hip and into the flexors across the front of our leg. We're going to move to the side and reach your arms. So you're going to feel the twist in your spine. Reach and imagine that you're plucking a flower from a shrub. So pluck the orchid here. Pluck and pull. Pluck and pull. What do you feel working here, Jerry?
I can feel it in my back.
In your back? Yes, you're really working into your back here. Pluck and pull. And remember, if you have back issues, you want to be careful. And used to be no pain, no gain. Now we say no pain, good. We don't want you to bring yourself to pain. All right, let's bring that hand back and drop it down, other side. This is also weight distribution, which is something that as we get older, we have a hard time distributing our weight evenly. So this is a good one to help us with weight distribution.
Yeah, a little bit with balance as well.
Yes, it is. And let's go ahead and bring that down and step it in.
I think we're just about out of time.
Yes, we are.
I think that's probably enough. So thank you so much for stopping by and giving us a little demonstration and talking a little bit about the classes and some things that are happening at Aging Partners. It's a tough time right now. We want to still encourage people to get out, get some movement, get some stretching. You're staying at home, you're staying safe, but lots of opportunities to be able to just do some things in your home.
And remember, there's lots of classes on TV, and the new Fit Lot from Parks and Rec and AARP is over at the Woods Park area. So check that out too.
Very cool. Tracy Foreman, thank you so much for being with us.
Okay.
Thank you all for tuning in. We appreciate it very much. I'm Jerry Renaud. And remember, it's never too late to live and learn.
Hi, I'm Randy Jones with Aging Partners. Did you know that Lincoln expects a 75% increase in the number of seniors living in our community over the next 15 years? Aging Partners is a community service that provides fitness programs to help keep older adults strong and healthy. This year, Lincoln Cares donations are providing funds for new fitness equipment. You can help make this happen. Sign up to support Lincoln Cares and add $1 to your LES bill each month.
Welcome to Live and Learn. Data from the CDC shows that every day about 200 people in the United States die from overdosing on opioids. I'm Doug Jose. Joining me today is Dr. David Rutz. Thanks for joining me today, Dr. David.
Oh, it's a privilege, Doug. I appreciate the opportunity to get this message out to as many people as we can.
You recently retired from your family practice that you had for over 40 years, but you continue to work with patients who have opioid drug addiction problems. How long have you worked with these kind of patients?
I've been at this, Doug, for about 14 years now, and it's been a very rewarding part of my practice.
Then what got you involved or motivated to sort of branch out in this kind of work?
Well, there were a few things. I mean, just to give you a bit of a background, I recall Dan Rather years ago telling us how doctors were not looking after all of the pain that patients experienced in America, and that we needed to get on board. And quite frankly, that was with opiates. Well, you spin the clock ahead 20 years, and now we're getting people addicted and misusing these drugs. We really didn't do it with a sense of trying to harm anyone. And we thought we were doing the right thing, but as it turned out, we really weren't. So I got involved with doing this primarily because I was a prescriber of opiates, and it concerned me that some of my patients could have gotten addicted not through any malfeasance on my behalf, but I wanted to be able to give them an option. Also, at the time, I had a mental health practice that was also in the building with me, and I thought it would be a good fit with the counseling services that they could provide and with the medication-assisted treatment that I will provide. And by the way, that it's called MAT, which stands for medication-assisted treatment, and it can be with buprenorphine, which is the drug that I use, or methadone. And I'm sure many of your viewers are familiar with methadone going back to the 1960s, in fact.
Let's talk a little bit about, before we get into the details, about what the situation actually is in this area. Is there a major problem in the Lincoln, Lancaster County area?
Yes. Interestingly enough, though, most of the patients with whom I've had interactions have been addicted to pills, primarily Percocet or oxycodone, which is the generic name for Percocet or OxyContin. In addition, hydrocodone is a very big one. And even tramadol, which is interesting because tramadol we've used a lot in senior citizens, and we found out that drug was also quite addictive. So that was another issue in regards to how we prescribe these drugs. And I think some of this just snuck up on us. So, but it is a problem. And the other thing that I have not really found in Lancaster County or Lincoln is a lot of heroin use, which is excellent. That's good news. One of the concerns was that as these drugs became harder to get from prescriptions because doctors are really beginning to shut down their prescribing of these opiates, that the price on the street was going to increase significantly, and heroin being much cheaper would be a major issue going forward. So that is still a concern that we have, but at this point in time, most of it's pills. And sometimes it's how they take them. I've had a few intravenous users, even of these pills. I don't even know how they manage to do that. They can crush it, they snort it, and other people, they chew them or just swallow them like they would if they were prescribed.
Before we get into treatment, actually, what do you classify as addiction? When someone comes to you, or when you're talking about this, how do you classify actual addiction?
You know, that's a good question. There are many people who have taken opiates for acute pain, a herniated disc from the back, for example. They may have taken them for weeks and it's never been a problem. There are other people who took the first pill and they were addicted from there on out. Now, the psychiatrists have what's called the DSM-5, which is the diagnosis and statistical manual that they use to define a lot of mental health issues. But basically, it kind of boils down to 4 C's. It's number 1 is control loss. These people do not have any control over the use of their drug. They have to have it. The second thing would be cravings. Even when they're not using the drug, they crave significantly. Even months after going through withdrawal, they can still continue to crave. The other one is compulsive thoughts. They think continuously about where the drug is going to come from. I've talked to mothers who could not feed their babies until they found out where their next fix was going to come from. And then the other one is continuous use despite harm. These people know they're doing themselves harm. They're damaging their families. They're damaging themselves financially, yet they continue to use it anyways. Those are sort of the 4 C's of addiction. And that's what separates somebody who's using an opiate maybe chronically for chronic pain, but is in good control of the use of the drug versus somebody who becomes addicted.
Let's then get into the treatment situation. You're actually prescribing another drug to control addiction. Tell us about that.
Yes, I prescribe a medication, but the generic name is buprenorphine. It first came onto the market as it was called Suboxone. And it's actually, when it first came out, it was a tablet, and now it's a film strip. This drug is administered underneath the tongue, interestingly enough, and patients cannot swallow because the drug is absorbed through the inside lining of their mouth. And that's very important to make sure they use it correctly. Buprenorphine is an opiate. And I get a lot of pushback from people saying, well, what good have you done? You're still prescribing this opiate. I mean, have you really solved a problem? Well, I use the diabetic as an analogy here. Their addiction is food. And as a consequence, they become obese. The obesity leads to damaging of their pancreas. And now they have to take medication or even insulin to stay alive. And I think it's the same thing with an opiate. After chronic use of opiates, there's some alteration in the brain chemistries, these individuals, they continue to crave in order to have a feeling of decency in their life. And it's that craving that we need to control. Otherwise, they continue to relapse back on these drugs. Even after months of going without them, for example, somebody in prison goes through withdrawal and they leave prison basically no longer addicted, but they cannot control the cravings. And within days, they're back on these drugs again. So yeah, buprenorphine is an opiate, and it does interact in the brain to keep these people under control.
So it's the craving mechanism that is in effect here. Is that how it works?
Yes. The goal of therapy, in fact, we always ask our patients when we follow up with them, are you having any withdrawal symptoms? Yes or no? And are you having any cravings? Those are the two things we want to control. And again, when people say, what good have you done them? Well, let's go back to those 4 C's. These patients are no longer craving. They're no longer continuing to use despite harm. They no longer have to compulsively think about where their drug is going to come from. They are in control. And in fact, they're abstinent because they're no longer seeking substances that give them that pleasure or what have you. So these people no longer satisfy the definition of addiction. In fact, they're abstinent. And I need to educate patients in that regard to make sure that they understand why we're using this medicine.
So when a person comes to you before you administer treatment, are there some conditions? What are the conditions that are required, or what situation do you require?
Right. Well, they need to buy into the program. And this is important because they're the ones that I need to hear from, not their spouse, not a parent, because if they don't buy into the program, they don't even show up for an appointment. Secondly, they have to be willing to stay abstinent from other substances. They have to be able to pass urinary drug screens that we administer to them. And they have to take the medication as directed. And it's important that we kind of coordinate with other physicians to make sure they're not being prescribed other substances that are potentially addictive and other substances that might actually make the side effects of buprenorphine more serious. And I digress a little bit because buprenorphine is an excellent medication for control of cravings and withdrawal, and it's also safer. There's a lot less likelihood of individuals dying from an overdose of buprenorphine than, say, from oxycodone or heroin.
So before you actually administer, are there some physical things that the patient has to do to start treatment?
Yes. Buprenorphine, if you administer buprenorphine to somebody who is not in withdrawal, let's say they are still high on an opiate like oxycodone or hydrocodone or heroin, if you administer buprenorphine to that individual, you will precipitate very serious withdrawal. So interestingly, they have to come into the practice for their induction in withdrawal. Now, I don't want them that sick, but I want them to be in moderate withdrawal so that we can induce them with this drug in order to prevent the precipitation of withdrawal. It is amazing to see how they come out of withdrawal when we administer this drug. They are amazed by it. In fact, when they leave, they're smiling ear to ear because they finally found something that's going to control their withdrawal and control their cravings. It's legally administered for the very problem from which they suffer. And it's done privately in the doctor's office. Their medical records are more highly protected for privacy than the medical records would be for any other condition. And that's another reason that the government did this, in order to bring these individuals into treatment.
Can any doctor administer this drug?
No. There is a short program. You can do this online. Doctors can do it online, or PAs, physician assistants, as well as nurse practitioners can be licensed. You do some training, and it's not that onerous. And then typically you're set up with a mentor. My mentor was at the University of Washington, and I used him quite regularly for about the first few months until I had enough experience to do this. It's called a waiver. And it's this waiver is attached to your license that allows you to prescribe opiates, which tells the pharmacist that you are prescribing this opiate to an addict for the treatment of their addiction. I have been getting talks around the community. I have been trying to get more physicians to sign up for this program. But interestingly enough, in the years that I've been doing it, there's still only a small handful of us in Lincoln that are licensed to do so.
Handful being approximately how many, David?
Half a dozen.
Is
maybe?
that right?
Yeah. So I don't know. It's one of those things. We teach our residents how to administer these opiates, but then when their patients get into trouble, they don't have the knowledge, the skill, or the license even to use Suboxone to get them out from underneath that.
What are the signs that somebody might be having a drug addiction problem?
I think that, and this can apply to any age group, but doctor shopping, with addiction, isolation becomes very significant. Absenteeism from work and activities, poor money management in younger individuals, slipping grades, and also a change in the social circle, again, especially with younger children or adolescents. They tend to shift from one social group to another depending upon their addiction to drugs. They seem to associate with those individuals from whom they can get their drugs.
Are there signs any different for seniors than any other age group, or and problems with seniors coping with it?
And I do have seniors in my practice that are being treated with buprenorphine, and I think that some of the ones that I mentioned are still appropriate for seniors. It's socially withdrawing, the doctor shopping, the losing medication, supposedly, the dog ate my pills, the excuses that we hear, and those do come up, interestingly enough. And so this can affect any age group. So we need to be aware of it. And as far as seniors are concerned, if they are knowledgeable or wondering about this, because they have children and grandchildren who might also be affected by this.
The children's situation, that might be the situation with the senior as opposed to themselves having a problem.
Yes.
What if you have a family, or the person has a family member or a friend that they think might have a problem? Is direct contact the required way to go, or what do you suggest?
Well, sometimes it takes a family intervention to get somebody into help, and again, the individual has to want to get better. And I think that if they knew the benefits of this medication, they would be much more open to try it. You bet.
David, this has been very interesting and very insightful here, the treatment. And I think we'll have some information that people can look at online as well to get information about who these doctors are. So yes. Again, thanks a lot for bringing us this insight and sharing your experiences with us.
No, thank you, Doug. It's been a privilege. Thanks very much.
Remember, it's never too late to live and learn about opiate drugs and the treatment of drug addiction.